Words have enormous power. They can uplift and encourage while inflicting deep wounds, often without the speaker's knowledge. This is especially true for people living with bipolar disorder, for whom certain phrases can be not only unhelpful, but also deeply hurtful. While some of these remarks may appear innocuous or well-intended, they frequently reflect misconceptions about the nature of mental health conditions. These phrases are not only hurtful to people with bipolar disorder, they can be upsetting to anyone because they frequently invalidate emotions and experiences. The goal is not to control language, but to raise awareness and empathy. Many people in our community have expressed concern that specific comments, no matter how well-intended, can exacerbate their problems. Understanding why these phrases are harmful allows us to be better allies and provide genuine support. Here are 10 of the most frequent and damaging things to someone living with bipolar disorder. 1. Have you tried just not taking your medications? This can be extremely dangerous advice, because managing bipolar disorder often necessitates close medical supervision, and abruptly discontinuing medication can have serious consequences. A healthcare provider typically prescribes and monitors bipolar disorder medications to manage symptoms and prevent episodes. It can be extremely dangerous and detrimental to a patient's treatment plan to advise them to stop taking their medication. Rather, offer your encouragement for their chosen course of treatment. I hope your treatment is working. How's it going for you? 2. You are just being overly dramatic or emotional. This can be especially hurtful because people with bipolar disorder often react strongly as a result of their condition, and being told they're overreacting can feel invalidating. Such a statement dismisses their genuine feelings and experiences, which are shaped by their brain disorder. It's critical to recognize that their reactions are not entirely under their control. A more appropriate response would be to validate their feelings. This appears to be having a significant impact on you. How can I help? 3. You don't appear to be bipolar. This is similar to "you seem so normal." This statement may make a person feel as if their struggles are being dismissed or that they are being judged for not displaying visible signs of their condition. Bipolar disorder has no look, and many people work hard to manage their symptoms while appearing stable. It is critical to understand that internal experiences can differ significantly from outward appearances. Instead, you could say, "I admire your ability to manage your condition." In your own words, how do you feel? 4. Snap out of it. This phrase minimizes the complexity and difficulties associated with bipolar disorder by implying that managing it is just a matter of willpower. Extreme mood swings, including manic and depressive episodes, are a hallmark of this serious mental health illness called bipolar disorder. The idea that someone can snap out of it downplays the significant influence these experiences can have on a person's life. Additionally, it disregards the need for therapy, medication, and lifestyle modifications in order to effectively manage the disorder. A more encouraging strategy would be to acknowledge their difficulties and inquire about how you can support them. For example, "I see you're going through a tough time. What support can I give you?" 5. All you have to do is exercise more. Exercise has been shown to improve mental health, but advocating it as a panacea ignores the complexity of bipolar disorder and the requirement for all-encompassing treatment regimens. Exercise is a component of a more comprehensive treatment plan that also includes therapy and medication. Recognize the intricacy of the situation rather than offering a quick fix. Exercise can be beneficial. What other elements make up your treatment strategy? 6. Why can't you just be happy? Emphasizing that happiness is just a matter of choice ignores the multitude of intricate factors that affect mood in people with bipolar disorder. For an individual with a brain-based disorder, choosing happiness is not an easy task. Chemical imbalances, external circumstances, and other uncontrollable factors can impact it. A person may feel as though they are being blamed for their condition and that this question is dismissive. Saying something like, "I'm sorry you're feeling this way," would be more encouraging. How can I support you? 7. You seem to have it all, so why are you depressed? This downplays the person's emotions and suggests that their situation in life ought to keep them from experiencing depression, which is not how bipolar disorder operates. Depression in bipolar disorder is a severe symptom that can happen no matter what external factors are present. It is not just a bad day. The following would be a more sympathetic reply. I realize that even though things appear fine on the outside, it doesn't alter how you feel. What support can I give you? 8. Everyone has periods of mood swings. The severity of bipolar disorder is minimized by drawing a comparison between normal mood swings and the intense highs and lows of the illness. Mood swings in bipolar disorder are more than just minor emotional fluctuations. They can be severe and incapacitating, impacting all aspects of a person's life, including relationships and daily functioning. A person living with bipolar disorder may feel alone and misunderstood after reading this comparison. Rather, try saying something like, "I can't imagine how hard this must be for you," to show empathy without drawing any parallels. If you feel like talking, I'm here to listen. 9. Perhaps you should pray more. Although many people find comfort in spiritual practices, this statement questions their faith and it minimizes the need for professional assistance and medical care. Bipolar disorder is one example of a mental health condition that usually requires a combination of spiritual practices, medication, therapy, and lifestyle modifications. I hope you find comfort in your faith, and I'm here to support you in whatever way you need would be a more beneficial statement. 10. I wish I was manic so I could get stuff done. This statement minimizes the severity of bipolar disorder manic episodes, which can include dangerous behaviors, restless nights, and poor judgment in addition to increased productivity. Mania is more than just an energy spike, it can be harmful and destructive. Saying this could unintentionally romanticize a very difficult aspect of the disorder. It must be exhausting dealing with mania, would be a more sympathetic way to inquire about how they are handling their symptoms. What enables you to manage? To wrap things up. Sticks and stones can break bones, but words hurt too. Talking carelessly can shatter self-esteem and stifle a person's motivation to have a life again. Instead, use statements that are more likely to strengthen relationships and support bipolar stability. People living with bipolar need the freedom to share emotions, challenges, and life issues honestly without worrying about feeling judged that everything about them is because of their condition. Talk isn't cheap. It pays to use words that encourage, enlighten, and empower. You can make a positive difference in someone living with bipolar disorder.